Hi, and welcome to our show. My name is Janara Iman. I'm a clinical nutritionist. I have a practice in San Rafael for over 30 years. Don't want to age myself too much, but I want to bring you good information. And the name of our show is Chronic Ailments and Scientific Nutrition. On this show, we bring you nutritional solutions based on lab analysis. One of the ways that we do comprehensive healing is using natural medicines. And natural medicines are those made by nature, extracted and combined in a way where they're bound to create natural healing in the body rather than using medications to do the same thing. So through labs, nutrition, and this type of supplementation, we can create healing in your body. And the name of our show today is Stress and Disease. Stress is an underlying cause of all modern disease and obesity, by the way, and we hear it all the time. We hear about how stress is an underlying cause, but really what kind of stress are we talking about? Because we can go through life and handle quite a bit of stress without it affecting us, because our bodies are built that way. We have a good central nervous system to start with, and it's designed to kick in when we need that extra stress response and handle things well, and then to subside. But what happens when it stops doing that, or when we become overwhelmed? Stress can build until it overwhelms our immune response. And since we all have stress in our lives, it doesn't mean we're all going to get sick, but we want to protect how our bodies handle continual mental, physical, emotional, environmental stress, and that's the key to staying healthy. So there really is almost no way to know if you have oxidative stress, which is what we're going to talk about, especially when in our labs, unless you have symptoms that bring you to the doctor because you don't feel good anymore, or you get comprehensive lab work as a preventative measure. Now, for the most part, you probably would have a difficult time doing that. And so we know what to do. We have lifestyle stress management things, we exercise, we try to have some fun, we try to balance the toxic things we do in our life with some healthy alternatives to reduce stress. If we have a good, healthy social life and you know, we have a balance between the good and the bad, we do pretty well until we get sort of into midlife, and then we start not feeling as well as we did in our 20s, and we start wondering why. Well, what is that? Because we live in a world that's a lot more toxic and stressful than generations before us, we often are having damage happen at a cellular level, and we don't even realize it yet. So some disorders caused by oxidative stress are numerous disorders. So we're getting into this oxidative stress theory here. But look, we have Alzheimer's, angina, anxiety, asthma, cancer, cardiovascular disease, everything from carpal tunnel syndrome, cataracts, GERD, fibromyalgia, erectile dysfunction, depression, all the way up to kidney disease, Lyme disease, Parkinson's disease. And this oxidative stress has been shown by clinical studies to be an underlying cause in all of these. And so we want to talk about it, and we want to look at it seriously. What can we do, and how can we deal with it? Because of this overload of stress in our life that we have now, these are the kinds of stresses that cause disease. We have worry, frustration, work stress, anger is not good for us. We're exposed to pesticides constantly. You know, we have things in our life that lead us to depression, and sometimes we can't pull ourselves out of it. And our state of mental, emotional, and physical health is part of that. Keeping the body to work in its peak will help prevent some of this, because as all these things, and this looks familiar, some people say, oh my gosh, I have all of these in my life. How do I deal with all this? We get overloaded. And on a cellular level, those healing mechanisms begin to break down, and we just don't have the mechanisms in place due to overexposure to these causes of inflammation. And these are just every day. I mean, in our food, we have toxins. We have organic food. Organic food also is rained on by clouds that went over toxic areas and Unfortunately, we do the best we can. But even our household cleansers and the foods that we eat and you know, the junk food that we are exposed to. I mean, what we do to ourselves and to our kids inside that we can't see creates damage over a long period of time. So we have major problems with cellular inflammation due to this oxidative stress. And so what happens, and this is a little cell membrane, and you've seen me talk about this before, but nutrients can't get into that cell, toxins can't get out. That triggers gene susceptibility, which interferes with cellular communication and dysfunction. And so the receptors on the membrane are blunted and we can't hear. So the first thing that goes is our hormones often, and we don't feel up to par. Our energy and metabolism are geared to dealing with other things, toxins, and it creates inflammation, and we have to deal with this daily, and it's going on when we're realizing it or not. So cellular inflammation now is a true underlying cause for 80 to 90% of conditions. And so what we want to talk about today is ways so that we know how to give you a customized cellular healing program to decrease glucose intake and cravings and ultimately reduce inflammation in your cells. So we give you protocols based on lab analysis, which is your individual picture, and we can see where this is going in your body towards disease as a preventative measure. So these nutritional medicines cause true cellular detox, which is what we want to do to heal. And so we ask ourselves, where am I going with this and where is it affecting me? We just talked about how it can affect our hormones, and the majority of the symptoms of hormone dysfunction are happening in you before they even show up on a blood test. And some of these things are weight gain that doesn't go away, doesn't respond to diet or exercise, sleep problems, fatigue, hot flashes, cold hands and feet, depression, thinning of hair and the eyebrows, brain fog, dry skin or thin brittle nails, infertility, constipation. There's more. I mean, are you going for the thermostat? Are you finding more hair in your hairbrush? These are signs of hormonal dysfunction, and sometimes we don't know them until it's time for a medication. They can get that bad because they don't show up in the average kind of doctor visit or blood test sometimes. Another kind is diabetes, and now we have clinical studies that show how diabetes is directly related to oxidative stress. And the Journal of Clinical Investigation, provided by the courtesy of the American Society for the Clinical Investigation of these things, quotes, obesity is a principal causative factor in the development of metabolic syndrome. Okay, so if you're overweight, you're headed towards diabetes. And we have a report now that increased oxidative stress in accumulated fat in the body, and this happens to some of us who are not obese as well, is an important pathogenic mechanism of obesity-associated metabolic syndrome. So if you have that low blood sugar slump, this also affects you. Fat accumulation is correlated with systemic oxidative stress in humans and mice, and these clinical studies have shown this. So collectively, they say our results suggest that increased oxidative stress in accumulated fat is an early instigator of metabolic syndrome or diabetes, and that the redox state in adipose tissue is potentially useful as a therapeutic target for obesity-associated metabolic syndrome. Now, are you going to get tested for this unless you're obese and you have symptoms? Perhaps, perhaps not. That's the beauty of preventative lab work. You know you have a problem when you stand on the scale and you don't like what you weigh anymore. And if you can't lose weight and you've tried everything, then perhaps it's toxicity at the cellular level, and that's what we're getting at, and that's what we test for. Toxicity is often the real reason why people can't lose weight, and it's affecting people's hormones and their health, as we were just saying. So why? Toxins are attracted to your fat cells. That's where they sit, and they disrupt your hormone imbalance or balance. So to understand weight loss in the 21st century, you have to understand hormones and toxicity and its effect at the cellular level. And we have to get true cellular detox or healing at the cellular level to change this. And there's a lot of studies showing this. So Nutrition can actually change our gene expression. Now, when we were born, we were given a set of genes, and that's what we inherited. And some of us had a little better genes than others. But regardless of whether our genes were amazing and we were, you know, born as athletes and completely healthy, or, you know, somewhere else down the ladder, our environment and our stress levels affect those things. And these are my little friends. These mice are the agouti mice. And they're very cute. This one's fat and chubby. And the only reason why this mouse is fat and chubby in the clinical studies that were done was because it was fed one toxic hormone, and that is bisphenol. So that's the plastic that we're all trying to avoid in our water bottles. And how many years have we gone jogging down the street, drinking out of those bottles, having them get warm in the sun, and then drinking out of them again? And we're taking in this, you know, this BPA, and we're toxifying ourselves. And so this little mouse here looked like this guy, and it was fed this toxin, this BPA, and this is what it became. So it became this yellow fat mouse, and we call it the agouti mouse. Now, just by methylating with nutritional supplementation and giving it the right ones, its little cells began to go normal. And not only did it look like this little guy again, once it had the right nutrition and the right supplements to really heal itself, its offspring developed normally, and its offspring's genes were up to par again. So yes, we are a product of our genes, and yes, we are a product of epigenetics, which is our environment and the toxins and everything else that we take in our body. And yes, we can do something about it, which is the good news. More things I want to talk about, though, in disease and oxidative stress is heart failure. According to the European Heart Journal, extensive experimental and clinical studies over the last 20 years have established that a fundamental process in the progression of chronic heart failure, especially in patients with prior myocardial infarction, is cardiac remodeling. And it explains a series of alterations in heart structure and function that involve significant changes in gene expression. Here we're talking about changes in gene expression again. How does that happen? And it affects protein function both in the extracellular and matrix and in the cardiomyocytes. So that happens to oxidative stress and environmental toxins and that exposure, and the toxins in the food we eat, and that inability of our body to handle prolonged stress over long periods of time. So markers of oxidative stress are elevated in CHF patients and have been correlated with myocardial dysfunction and overall severity of heart failure. That is a quote directly from the European Heart Journal in their studies. So this is not a little matter that we're talking about. It's pretty serious. And what the good news is through proper nutritional supplements, we can change the gene expression and cause the healing at a cellular level. So then your DNA is not your destiny. When we get down into the cellular level, we can get those cells, making the glutathione again. We can increase the ATP, and the oxidative stress and the inflammation goes down. And we can do it preventively, because you hear this all the time. My blood work and physical exams look normal, but I am not functioning well. What is wrong with me, and why don't I feel good? And your doctor will say, I don't know. Maybe it's all in your head, or maybe you just need a few good nights of sleep or some more exercise. But I've had many patients who have gone on marathons and trained for them and tried to get more sleep and tried to get more exercise. And basically what they ended up with was in chronic fatigue due to oxidative stress and inability, because they didn't have the knowledge of what to do and how to do it to get these toxins out of the cells so they could heal. And we are bombarded by these so much nowadays. So very important to look at this. So you want to start a cellular healing program, and you want to do it with nutraceuticals and natural substances that are extracted and condensed and directed directly to the cell. Target the cell inside of the cell to increase its ability to do its job, to heal yourself. And these are some key products that work at a cellular level. And a supplemental system of this kind, which we can put together for you based on your lab work, will begin to heal cellular inflammation, gene expression that has gone awry, and the toxic levels in our body. So prevention is the best medicine, of course. However, as we were just discussing, most physicians may not test you until you have a severity of presenting symptoms, and I hear this all the time. One patient I was talking to was telling me that their doctor wouldn't give them any lab work until they were severe enough to warrant it. And this was for a hyperthyroid patient, and there wasn't anything they could do until she got, 2 degrees sicker on the scale. Not a good situation to be in, but when we're using natural medicines, food, herbs, and nutraceuticals, we have the ability to do prevention, and we can do it at any level that you're at. We can start no matter how bad or how what level or how good you're doing at the same time if the process is beginning. So we don't want to be depressed over this stuff. We want to take action. We want to do something about it. So we do lab testing based on health. And what we mean by that is we want to base our scores from the lab work comprehensively on healthy people's scores. So when you go in and you get your lab work done and you don't feel good, those scores are averaged into a whole group of scores, and then there's a normal range created. And consistently that normal range has gone down over and over. Again, over the years, so the normal range is no longer a healthy range, basically. But you get into functional ranges, and those are functional highs and functional lows. And that looks pretty good on your lab work, and you feel pretty good about it. And you may get a medication, and you may feel better, you may not. But as long as you're in these functional lows and highs, you're pretty much stabilized in the medical profession's eyes. So you may not feel optimal, but we don't want to look at it that way. And we don't ever want to get into abnormal lows and highs, because now we're in a real disease state. So by doing lab analysis based on healthy people's scores, we're looking at prevention. And here is a sample of a hair analysis that's part of our blood testing. And when I say comprehension, we're doing blood, hair, and urine to get a biomedical picture of you that's pretty complete. And so here you see in this test what that looks like. And you may have seen this before because many of us have had hair analysis, but the top part of it shows what's toxic, and so anything over the green level there is perhaps a toxic. This one shows that this person has toxic silver, some titanium issues, and down here is mineral deficiency. You want to be in the middle. So if you're seeing yourself over on the left side, you're mineral deficient, and if you're seeing yourself over on the right side, you have too much of a mineral, and that creates toxic levels as well. So all of these are pretty important when we're looking at blood work. This is a sample of a test comparison of 52 different lab tests that we do in our comprehensive package. So we're testing all the levels of what your state of health is rather than just what your symptoms are showing in the moment. And this is a before, and this is an after 6 months. This person came in, and what you're seeing is red here. This is not so good. These are serious warning signs of things we need to deal with. The yellows are you're falling into some caution. We need to take steps to help you at this point because you're falling backwards into the red zone. And when you see blue in here like this is not good at all. This is more like a code blue, act now. Putting this person on a nutritional program based on their total comprehensive lab work with nutraceuticals and supplements and dietary situation that was designed for them, their test looks so much different now. Without medications, you see most of the red is gone. and all the blue is gone, and much of the yellow is gone, and there's been a big improvement because the body wants to heal itself. It wants to bounce back, and if we know how to give it what it needs, and we're not stabbing in the dark, we're not reading online, oh, maybe I have this symptom, maybe I have this syndrome, this vitamin is supposed to be good for this, maybe this will help me. That might be okay, but it's not the true way to look at it because you're not getting to the core. This kind of testing shows the core. And so when you combine it with the hair, and then when we combine it with urine analysis and a meta-oxy test to show oxidative test, then we really get a better idea of where we can start and what you need. And you're going to probably find you need less than you thought if you were in a place where you didn't feel well. The reason why hair analysis works is because our body's always casting off things. When it's working very well to try to eliminate toxic exposure that causes this oxidative stress. And so you can see these little white things as illustrated as the toxins that are eliminated from this artery into the hair follicle. And then when that's cut off and tested, that's how we get the results, and that's what we know what's going on. Urine analysis combined with a meta-oxy test shows the oxidative stress in the cells right here and now. And this is 50 times more effective to show oxidative stress than most blood work, but we need the rest of it to see the whole picture. You might take this alone and say, oh yes, I have oxidative stress. And if you did, I would give you antioxidants and put you on a specific diet. But actually we wouldn't know the core. So the beauty of it is the comprehensive test combined so that we could see everything going on together. This tests something called urinary malonaldehyde, which is lipid peroxidation. And that's serious free radicals. So we want to know that. We want to know what's going on because stress and toxic exposure has become an epidemic. It's huge. And how we started off this show by saying that it's 80 to 90% of the underlying cause of disease, that's serious. Those are serious statistics. So our approach is get your lab results and your nutritional recommendations, but get them so that they're comprehensively based on you and get a whole biomedical picture, not just a piecemeal. And then we can fix your cell, remove the toxins, restore your cellular function, and give your body what it needs to heal itself. And it's actually pretty simple and beautiful that way. It's what nature intended us to be able to do. So now we're using nutrition as medicine. And we're taking all these substances and we're eating them and we're extracting them and we're putting them into capsules and we're giving you the food that you need in concentrated forms in addition to the recommended dietary intake. And we find this out by what you're missing from your nutritional report testing, and it's very effective. So back to the labs. Comprehensive lab testing results are based on the averages of thousands of healthy people. It's put into a computer. The computer doesn't make any mistake in reading this, so there's no human error. So you end up with a customized individual nutritional recommendation on your complete biomedical picture, not your spouse's or your neighbor's. And by using computer analysis, there's no mistake. There's no guessing and there's nothing missed. So we love that system. It's a system that is designed to be preventive, but we can change the state of health of our cells, of our gene expression, our hereditary factors, and all of these things just by getting the right picture. It's like taking a snapshot. So this show is brought to you by the compliments of the Community Media Center of Marin. And we want to thank them for this facility and for their generosity in letting us bring shows to you of this quality so that we can be effective. The show airs on Channel 26, Saturdays at 4:30 p.m. My website is vitalnaturalhealthsolutions.com. And my name is Janar Aman. I'm a clinical nutritionist. So if any of these topics have, for some reason, touched you, if you're one of these people who feels that you may not be heart healthy, but you haven't taken the time to figure out why. If you have shortness of breath, if you're gaining weight and you don't know why because you're exercising and you're eating the right foods and you're having a healthy diet, if you have an excessive amount of stress in your life and you don't seem to be able to pull out of that stressful state of anxiety, and you're in a chronic state of irritability, anything like that, or if you've gone to the state of depression and you're figuring that only thing that can help you is medications, and you have any questions, I can help you. I can help you answer some of these. We can find out what the core of this is, and you can prevent yourself from starting on a series of medications that perhaps would take you further down onto the disease ladder. And perhaps by giving yourself the nutritional supplementation and some good tools, you can prevent a lot of disease from starting to begin with. And if you're in that place where you're now past that point where you still need to have medication, there's no reason why you still can't feel as well as you did when you were younger. And so that's the whole point of nutritional medicines. We want to give the body what it needs to heal itself, and we want to do it as naturally as possible so that you have the kind of life and lifestyle that you deserve. Thank you so much. May you be in good health.